Hello, everyone. This is Divya, and I cannot tell you how thrilled I am to bring Dr. Ankit Shah today. We are going to be covering a lot of good topics for athletes. And I want to share with you Dr. Ankit Shah is a sports cardiologist. And for young athletes, we don't even think about the things that they need to focus on. So before we get started, let's ask Dr. Ankit Shah. So, Dr. Shah, can you share with us what got you in that sports cardiology?
Yeah. As I was thinking about what I wanted to do, I thought about merging two of my best interests, which was cardiology and athletes in sport. And sports cardiology was the perfect fit. I actually rode crew in college, and unfortunately, I had a teammate who died suddenly, had a cardiac arrest after finishing first place, and he was not able to be resuscitated. And so when we think about young athletes, unfortunately, some of them are born with heart problems or they have genetic heart disease. And so while they're some of the fittest, healthiest looking people, some of them have underlying heart disease. And so this is a really nice field that helps sort of navigate both the young athletes and the older athlete.
And that's one of the things that we don't think about because there are parents, and I know so many of my friends have young kids, and they think, like, if that cardiology is only for older people. So can you tell us, like, if whether you're a parent of a young athlete or if you're a young athlete yourself, like you are in sports, so what are the things that they can look out for?
Yeah, absolutely. I mean, so one of the first things is dividing it a little bit by age. So if you're less than 35, you're thinking about things that are going to be something they're born with, a genetic heart problem or a congenital heart problem. And so signs and symptoms that you shouldn't ignore are chest pain, shortness of breath, passing out, lightheadedness or dizziness. If you see all of your other teammates are going and you always are the slowest or always have to stop more or take more breaks and you can't keep up, that might be a red flag. So the biggest thing is to not sort of ignore symptoms.
Okay, so you mentioned about that, there may be some athletes who may have congenital heart problems, but so many times because when they're young, people don't even check for it. So you have talked about the symptoms. So just as an athlete, especially like, whether you're in college playing D1 division or like even if you're in high school or now if you're in Olympics or professionals, what could they do so that they know that they do not have congenital or they can rule it out?
The best thing and the biggest thing is going to see a primary care or pediatrician every year and making sure you go through the whole list of symptoms. They'll ask you about your family history and be honest. If you're having symptoms, don't ignore them. Let him or her know, and they'll send you to a cardiologist for further workup. In certain scenarios, an EKG or electrocardiogram can be indicated, and that can pick up a lot of the causes of sudden death in athletes.
No. And this is such a specialty field. And as you talked about looking at the symptoms, so can you share with us? I'm going to go back to the first thing that you mentioned about your rowing teammate as to what happened. What mark did it leave on you?
Yeah, I mean, being at that age and losing a teammate, and obviously, I mean, having someone who, again, you thought was extremely healthy and one of the fittest athletes on our team, and for him to die suddenly, it's obviously profound and it has, an impact. And this is part of my giving back and just sort of learn and try to prevent another athlete from dying suddenly if I can.
And I know because you, as we have talked previously, you were very young at that time. And such a loss can be prevented.
For the most part, I mean, actually, this is a nice segue into what we can do. And so sometimes, regardless of whatever screening you do, cardiac arrest will happen in young athletes or in older athletes. And so being prepared is the best thing we can do. So emergency action planning, which is like the defibrillators, having AEDs on the sidelines in the practice environments on the field is one of the best things that we can do. Families and students should learn CPR.
You brought up a really good point that family and students should learn CPR. So what would you say is like the common practice nowadays?
I mean, so American Heart Association has like a 2-minute online hands-only CPR video. So taking that, I mean, the best thing would be actually getting a class and being certified, but not everyone has to do that. So you can watch the American Heart Association videos on hands-only CPR and then learning how to use an AED. They actually are automated. And so even if you've never used it, you shouldn't be nervous because when you turn it on and open it up, it actually walks you through each step and says, put the pads on the patient. It tells you to step away or to chart or hit the shock button. So it actually walks you through the whole process.
So we have now talked about the prevention. We have also talked about what you can have on hand. Now, as far as athletes are concerned, what can they do in their day-to-day lives to keep their heart healthy?
Yeah, I mean, so we know that exercise is one of the best things you can do to keep your heart healthy. And then everyone should be doing, I mean, at least 150 minutes a week of moderate exercise, which can be brisk walking. For the athletes that we see typically are doing way more than that in vigorous exercise. And, I think the common misconception is that you can eat and drink whatever you want if you're an athletic. And so I see that all the time. But unfortunately, those are risk factors. And so I try to educate all of my patients, all my athletes on the fact that you have to maintain the rest of your lifestyle also in a healthy way. There's also this sense that if I'm an athlete, I don't have any underlying medical problems. What we've seen and when we studied some of the ultra runners from a local race is that, about 18 to 20% of ultra runners have a cardiac risk factor. So don't ignore blood pressure, cholesterol, diabetes, because all of that can be treated and should be treated regardless if you're an athlete or not.
No, you said it like, okay, I'm exercising, I don't have to pay attention. So this brings home really a good point that it's important that how you're living your life, just because you're an athlete, doesn't mean you stop there. You take care of the rest of the life.
Right.
So, Dr. Shah, I know you've worked with a lot of professional leagues and professional teams. So can you share with us one of the teams that you work with and any story that you may have that how you have helped athletes maintain not only their performance, but good heart health?
Yeah, absolutely. So, I mean, locally, when I was part of Mentor Health, I was actually a cardiologist for a lot of the local teams here, Baltimore Orioles, Washington Capitals, Baltimore Ravens. And I'm still the team cardiologist for USA Swimming, the national team. And, athletes and taking care of them is in a lot of different perspectives. This field is very unique. So there's obviously the patient in front of you or the athlete who comes in to see you with symptoms. But when you work with some of these teams that are national, I've gotten phone calls from my colleagues who are on the field, so to speak, from around the world, from different parts of Asia, when they had an athlete who was in an emergency room in Asia, and they called me and said, "Hey, is this the right plan? Should we be doing this?" And so you can sort of help guide an athlete from around the world. And then more recently, we had a tournament locally, and there was an athlete who had seen a cardiologist in London, had an issue locally, and so we connected virtually with his cardiologist, with the athlete, with the athletic trainers. It's really a full team sport. And we created a plan for him, and we got his heart procedure done the next day, and he was back playing tennis 2 weeks later. So it's really, really nice.
So that's fantastic. That just because if you have any issues doesn't mean that your career is over.
Yeah, definitely not. I mean, there's a lot of things we can treat that if we find and hopefully be fully corrected and go back without much risk. But one of the things that we've learned is that, this whole engaging the patient and having them be a little bit autonomous. And so shared decision making, that we try to engage the patient and say, hey, this is what we know, but there's a lot that we don't know. We think potentially this is a low risk condition. And if you want to pursue it, we'll sort of work with you to keep you as safe as possible. In certain scenarios, we do think it's too high risk, and we sort of recommend against competitive sport, but we can still try to keep them active.
Oh, that's fantastic. And you have mentioned about a lot of different values, like, okay, you can do this, you can have these things, but what can they do actively? So let's say if somebody, any regular athlete were to come to you, so can you share, like, how do you take care of them and how do you help them with their performance?
I mean, it really depends on what they're coming in with. So if it's an athlete or someone who's just trying to get started with activity and exercise, we sort of recommend that they slowly build up and engage with them. For people who are already triathletes, we put them through our testing or, based on their history and make sure they're safe to continue. And then, based on some of the tests we do cardiopulmonary exercise testing. It can provide them some data that they can then take back to their coaches and work to sort of specify their training programs.
And a lot of our audience may be thinking, they're athletes and they're thinking, okay, I know that Dr. Shah's heart is in the right place because his why is bigger than who he is. He wants to give back to the community. And think about it, as young as he was in college, you're like 18, 19 years old, and here you are touched by your teammates' unexpected accidental demise. And he is in here for their heart. And as I have observed him, I have observed Dr. Shah bring his heart and care to athletes. Can you share that what would be different coming to you versus going to any other place?
Yeah, well, there's very few people that are fellowship trained in sports cardiology. But then bigger than that, I mean, I think you coming into this office, you'll know that we actually genuinely care about your symptoms and want to work with you to either figure out if there's something wrong or to make sure everything is okay. The practice is a little bit different in that we try to, we have a lot of patients coming from out of town. And so we will try to coordinate all of the testing same day. I'll review everything before you leave. And so we'll have a plan at the end of the day or end of the visit with what to do next, or if everything looks okay, to sort of, recommend that you don't need any exercise restriction. And, in terms of the practice model itself, there's no phone trees. People are answering the phone. The appointment times are longer and not sort of hurried and limited.
Yeah. And as I know, you have athletes coming to you from all around the country. So if you're an athlete or if you're a parent of an athlete and want to have good performance and good healthy life, and if you're looking, and I don't know about y'all, I know for me it's important to have the right doctor, the right lawyer, the right accountant, and those people who are in your corner and who will not only root for you but who will uplift you and take care, then you will be in the best hands of Dr. Shah. That's what I can tell you. And I've seen Dr. Shah over the years, and amazing care. You cannot find a better doctor than Dr. Shah. So if you're there, definitely check it out. And can you share with us your website and where people can find you?
Oh, absolutely. I'll say it's very common for us to see second opinions as well. So a lot of people who've seen 1 to 2 or 3 cardiologists want to come in with all that data, and we review it and can, make sure everything was done correctly or give a different path. So our website is www.sportsandperformancecardiology.com, and the phone number is 240-892-7070.
Well, thank you, Dr. Shah, for joining us today. And it was such a pleasure having this conversation. And thank you for providing the nuggets. And you can listen and you can reach out. And for any other things, of course, you can reach out to us. As always, we are here to support you, at your service all the time. See you next time. Take care. Bye.
Thank you.